So good morning, sir. So congratulations that our hospital is celebrating World Diabetes Day today, tomorrow, and day after tomorrow. So there is one request. Can you please tell us about the diabetes in detail for our viewers? Like what is diabetes? What are the causes of diabetes? What are the precautions and how it affects on our lifestyle? Because many of us we don't know about it. So we request you to have your own opinion, sir. Yes, sir.
Hi. Good morning. I am Dr. Patel, Senior Consultant Physician, National Heart Institute. Diabetes is basically a metabolic disorder that affects our body where blood glucose remains high persistently. That is because of maybe insulin deficiency or insulin is improperly formed or improperly working. There are two types of diabetes, type 1 diabetes and type 2 diabetes. Type 1 diabetes is basically insulin dependent diabetes where there is no formation of insulin takes place in our body. Type 2 diabetes is where the insulin is formed, either inadequately formed or formed but not working properly. So the diabetes is very dangerous disease. We should be very careful in our life. Nowadays is affecting at all ages groups of the peoples. The type 1 diabetes occurs at any age, but mostly it occurs in childhood, adolescents, young adults. Where type 2 diabetes also can occur in age, but most commonly over the peoples of age above 35 years of age. Okay. There are some symptoms of diabetes like increased thirst, increased urination, increased hunger, generalized weakness, fatigue. These are some common symptoms of diabetes. So it is very dangerous, so we will be very careful for it. There are some important causes of diabetes like environmental factors, genetic factors, lifestyle, and some other factors like polycystic ovary syndrome, gestational diabetes in pregnancy. And there are some precautions for the diabetes. Most common precautions are be careful about our diet. Our diet should be very balanced diet, low carb diet, high fiber diet, and low fat diet. Mostly the saturated fat should be avoided. Be careful and choose the diet perfectly. Number 2, exercise has a very important role in our life to reduce diabetes or prevent diabetes or control diabetes. The exercise should be at least 150 minutes per week or 20 to 35 minutes per day. The pattern of the exercise should be either vigorous walking or those who are fond of swimming or cycling. These are the important exercise that can help to reduce the diabetes, prevent the diabetes, and even to control the diabetes. So,
if suppose we are having a family history of diabetic people, so it is necessary the offspring will also have the diabetes?
Yes.
At any point of age?
At any age, if the family history is there, then patient can develop diabetes at any age. In such conditions, we should be very careful regarding our weight, so that obesity is the major factor for diabetes. Obesity is the major factor for diabetes. Environments are diabetes. Smoking are major factor of diabetes. Sedentary lifestyle is the major factor of diabetes. So we should be careful for about all these things. So for the peoples who have genetic history, they should be precautious and at least yearly blood sugar testing to be done, like including cholesterol and some other tests to be done to rule out the timely detect and treat the diabetes.
Sir, diabetes is a kind of a deadly disease, or
yes.
It's can cause slow death, affecting organs or something.
Generally, it's a very deadly disease. It can cause slow death. Very rarely it can cause sudden. slow death, like it can cause heart attack, it can cause brain stroke, it can damage eyes, loss of vision, it can damage kidney, it can damage nerves. So it can damage from head to toe. So it's very deadly disease.
And the medication of diabetes is like a lifelong.
Medication of diabetes, first of all, patients should be start medication with the help of their physician and follow their proper advice about precaution and proper treatment. And treatment should not be stopped without the permission of his or her physician. First, once he started, it should be continued to maintain the HbA1c level and blood sugar level.
Okay, thank you so much, sir, for clearing our doubts. And definitely, I would like to request viewers and audience, like if they want to have some more information on it,
Yes.
then they can contact you.
Yes, you can get it.
Thank you so much, sir.